afternoon. Today we are with Dr. Khomotso Vilakazi-Nhlapo, who is a qualified medical doctor with a postgraduate qualification in public health. She has been working in the National Department of Health as a senior medical manager responsible for TB integration program and the implementation of the viral hepatitis management guidelines. Dr. Nhlapo, please switch on your camera and unmute your mic so we can have a short little conversation.
Thank you.
Welcome,
and
Dr.
good afternoon.
Good afternoon, Dr. Nhlapo. Good to have you here with us today. We've got a few questions for you, and hopefully you will be able to give us clarity on some of the issues that we have. If briefly you can just indicate to us, what is TB preventative therapy?
Okay, thank you for the question. TB preventive therapy is the prevention of the progression from TB infection to active TB disease through the administration of one or more anti-tuberculosis drugs, like you can give isoniazid for 6 months or for 12 months in patients who are HIV positive and are on HAT, or you can give a 3-HP, which is a combination of rifampicin and isoniazid for about 3 months, and you give it once a week. Or it can be a combination of rifampicin and isoniazid also for 3 months, but this is daily. And for patients who are not who have contraindications against isoniazid, you can give 4 months rifampicin. We must note that it doesn't prevent TB disease or TB infection. The people who have actually developed active TB disease whilst on TB preventive therapy. But it has been shown to prevent progression to active TB disease in high-risk populations, including people living with HIV and TB contacts of people who are actually on TB treatment.
Very much for that, Dr. Nhlapo. What is LTBI? We use acronyms, and sometimes these acronyms tend to be a bit confusing. What is LTBI?
LTBI is latent TB infection. So in somebody who's immune competent, like whose immunity is good, they get infected with a Mycobacterium tuberculosis, and the infection is contained. The bacilli remain dormant in the body, that is, they are not active. Hence, TB infection. But sometimes bacilli are reactivated, that is over time. So in your general population, that people who are immune competent, if it happens that for whatever reason their immunity is lowered, like 5 to 10% of people, they will develop TB disease in their lifetime if not treated for their infection. In HIV positive, it's even more, they're at a high risk of developing active TB disease after latent TB infection, which is about 5 to 10% per year, not per life, like those who are immune competent.
Thank you very much for that, Dr. Vilakazi. Very informative indeed. But can you just indicate to us what is the impact of treating the latent TB infection on the TB burden?
If it has been shown that if you implement both TB preventive therapy and TB treatment, this can lead to the elimination TB disease in terms of incidence of deaths and cases. More effective treatment of active TB could move an epidemic into the elimination phase with less than 10 deaths per million per year. This is from studies that have been done where it has shown that combined treatment of active TB and latent TB profoundly reduces the number of TB deaths. So treating both active TB and LTBI is the only way to approach elimination of tuberculosis. So it means that if somebody is, let's say, HIV positive, they're screened for TB and they're found to have TB, then they need to get TB treatment. And if they're not on TB treatment, we definitely need to screen them, to screen them for TB preventive therapy and give them TB preventive therapy. So we cannot just do only one intervention. We need to do all the interventions to ensure that we have elimination of tuberculosis. This includes also other activities like your infection and prevention control and measures, and educating people about how to prevent TB spread.
Thank you very much. You touched on TB preventative therapy. And can you just basically give us an indication in terms of our high risk groups? How is it important to actually give this TB preventative therapy to them in order to be able to prevent the progression of the TB disease?
Okay. It is important, as I said earlier, like your HIV positive individuals, they're at higher risk of the latent TB infection progressing to active TB disease. So it's important that if they are screened and found not to have active TB disease, we need to offer them TB preventive therapy. So this is adults, it's adolescents, and child contacts after significant exposure. Child contacts is those who are less than 5 years and those who are between the age of 5 and 15. We need to ensure that with every contact they are screened and offered not to have active TB disease. This also includes inmates in correctional centers. We are also finalizing guidelines for occupational health screening for TB and HIV of our healthcare workers, just to ensure that they're also protected against active TB disease. People who are immunocompromised, regardless of known exposure, we know, as I mentioned, people living with HIV. We also have people with silicosis. We know that they are also at high risk of developing active TB disease. So they should also be screened and offered TB preventive therapy. Patients who are on treatment for cancer, they should also be screened and offered TPT. Those who are on dialysis, or even those who are preparing for organ or hematological transplant should be offered TB preventive therapy. We know that we have a high burden of tuberculosis in the country, so it's important that we ensure that those who are most vulnerable are actually treated with TB preventive therapy to ensure that they don't get active TB disease. Thank you.
Thank you very much, Dr. Nhlapo. I mean, this has been truly informative. I actually appreciate the way you actually highlighted the risk groups for some of us out there who might be asking which are the relevant risk groups that this would be applicable to. Thank you very much for this information. And I guess the take-home message at the end of the day is TB is curable. And we should do whatever that we can be in a position to do to either prevent it, to treat it, and to cure it. Thank you for your time, Dr. Vilakazi. It has been lovely chatting with you today. Any last
Thank
parting
you
words from your
for the
side?
time and the invitation. Much appreciated.
Doctor, enjoy the rest of your day.
I can have summarized it better than I can. If somebody is vulnerable, they should either be on TB preventive therapy or TB treatment. So it means we should always screen those who are most vulnerable for TB and ensure that they are managed properly. And it's important to note that we have revised TPT guidelines. Previously, we only had TPT offered to people living with HIV, adults and adolescents, and children 5 to 15 were HIV positive and no contacts of TB cases, and children under 5, irrespective of HIV status, who were contacts. But now we have increased the pool of people who are eligible to household contacts, irrespective of HIV status. And as I said, even healthcare workers are being considered for TB preventive therapy, irrespective of their HIV status. Thank you.
Thank you very much, Dr. Vilakazi-Nhlapo. So clearly, screening is important.
Yes. Screening, even it's important also to note that even if a patient is on TB preventive therapy or even TB treatment, we still need to screen them for TB whenever they access our facilities, because they may be on TB treatment, but they may be having some resistance and are not responding. And if we don't inquire, we may miss out on patients until it's too late. And even with TB preventive therapy, we need to screen them also for TB, because some have developed TB, active TB disease, was on TB preventive therapy. And there are also issues of adherence. We need to ensure that patients are adhering, and we need to ask a question, because if they're not adhering, they may be having some symptoms, and if we don't prompt them by asking them the questions, we may only find out later when they actually developed the disease and even complications that indeed we missed the patients. So it needs to be a daily routine to ask them for TB symptoms or signs, and continue educating them, especially with regards to TB preventive therapy, because they may not be sick, that these are the benefits for TB preventive therapy. We don't want to develop active TB disease.
Thank you very much for such insightful information, Dr. Vilakazi-Nhlapo. From our side, we are done for the day. Thank you for your time, and I hope this was as informative to everybody else as it was to me. Thank you very much, ma'am.